Tummy tucks are considered one of the core 5 major surgeries that we do as cosmetic elective plastic surgeons, and tummy tucks are what we're going to talk about today. I'm Dr. Matthew J. Nykiel, board-certified plastic surgeon in sunny Southern California. I have offices in Newport Beach and Upland, California, and let's dive in to the tummy tuck. The goals of tummy tucks have changed over time. Originally, very similar to facelifts, we made an extremely tight looking tummy. Now, while this looked great initially, and it did achieve the goals of people wanting a tight tummy, it created a very unnatural appearance. It created a sort of tight shape that really never looked like it went along with the body. Since then, we've focused more on a natural shaped tummy, removing excess skin, but also starting to create natural shapes, sort of dips in the belly, highlighting edges of the rectus, hot muscle, highlighting edges of the midline of the tummy, really starting to show that shape change that we would expect to see in a tummy tuck. And overall, we've been able to create a more natural shape that incorporates and balances the body very nicely. From a trend standpoint, tummy tucks are being done more. And the reason for that, quite honestly, is the GLP-1s or the weight loss medications. We're seeing people very commonly lose 20, 30, 40, even 50 pounds, and that creates loose skin, and therefore we are doing a lot more tummy tucks than we were doing even 1-2 years ago from the effects of these weight loss medications. The goals of a tummy tuck are really threefold. Number 1, remove that excess loose hanging skin. It's also called a pannus medically. Number 2, tighten those tummy muscles back up. Now, typically the tummy muscles sort of relax or separate from childbirth or from major weight gain and then weight loss. And finally, number 3, with all that stretching of the tummy muscles and the skin itself, the belly button can sort of create a sad shape or a non-sort of normal looking appearance, and we want to reconstruct or rebuild that to get more of a circular shape to the belly button. And to do that, the surgery takes us roughly about 3 hours. It uses general anesthesia, meaning you're asleep when the surgery is done. An anesthesia provider, along with the whole OR team, will be there to help monitor you. The procedure itself is outpatient surgery, meaning you get to go home after the surgery. Now, outpatient surgery only works with good, responsible adults taking care of you. And as long as you have one who can be with you for the first 72 hours, you're able to go home. Some people don't, and that's okay. We have private nurses and we have recovery homes to help take care of you after the surgery. Most people are going to take about 2 weeks off of work from a recovery standpoint. Tummy tucks are one of the bigger procedures that we do in cosmetic plastic surgery and therefore require a little bit longer of a recovery process. There have been major advances from a pain management standpoint in tummy tucks and really in plastic surgery in general. I utilize a product called EXPAREL. And the easiest way to think about EXPAREL is it's similar to lidocaine, like you get at the dentist, but it's going to last for about 2 to 5 days. And we use this along the actual tummy muscle repair. The tummy muscle repair, if you've ever had a C-section, is what most people feel the most of. So if we're able to decrease that pain for, again, 2 to 5 days, we're able to get you up, moving around, and on a quicker path toward recovery. We also like you to wear leg squeezers for the first 2 weeks. The biggest risk from a tummy tuck is what we call a DVT, and those have the potential to turn to a P, or pulmonary embolism. One of the easiest things we can do is just create a leg squeezer that you wear for 2 weeks. These are totally wireless, which makes life very easy. They hold about an 8 to 10 hour charge, and you just have them on at all times, except for when you're in the shower. And finally, we like to keep you in a compressive garment. Now, part of what we want to happen is that skin and soft tissue to sort of form and reshape. And while we can't force it to happen, we can influence it. Just like the bone doctors can splint or cast your bones to heal in certain ways, we can splint or shape your body to heal in certain definitions. So part of your pre-op, we will size you for the different garments. After surgery, we will fashion different foams if necessary to help create shape and create definition. Now, the tummy tuck is typically part of a bigger procedure, a mommy makeover. And that usually includes a tummy tuck plus something else. It can be anything from breast augmentation, breast lifts, liposculpture, or shape changing of the body. Most of us will do some liposuction with a tummy tuck. A tummy tuck itself helps to tighten skin very nicely, but it doesn't create those shapes and curves that we look for. Liposuction does. We also utilize lipo to help create those little dips in the midline of the tummy or on the edges of the rectus muscle, your tummy muscle, that kind of create that sort of soft Pilates look or yoga look that people typically are going for when we shape the tummy. In a male tummy tuck, we'll go a little bit harder because obviously we want to create a little bit more definition around those muscles. Want to learn more about the tummy tuck and how we can use it to help shape or rebalance your body? Come in for a consultation. Just for browsing or want to learn more on it, like, follow, subscribe. Check out our educational video. We've made tons of resources to help you along this path of restoration towards confidence.